Now, I just wanted to give a few practical, pragmatic tips on how we can protect ourselves with a virus as well. I discussed this last time. It'll be a continuous series. I'll talk about different ways about avoiding infections and avoiding strengthening immunity and so forth. And inshallah, we'll get some experts as well in the field to comment. But I wanted to mention something, okay? Today, to inshallah, I haven't seen this mentioned too much out there, so I wanted to try to highlight or focus information perhaps that has not been distributed so much on mass media and so forth, but it's something that perhaps we can take advantage of. So we know that the primary way that we are trying to protect ourselves from this virus is through social distancing, okay? You know, by not approaching other people, we are trying to protect ourselves from this virus. So the prevention, the whole idea of isolation, social distancing is prevention. Okay. So Allah subhanahu wa ta'ala, He tells us in the Quran, وَلَا تَقْرَبُوا zina, right? So do not approach zina. So وَلَا تَقْرَبُوا corona. Right now, we are trying to avoid approaching corona, okay, the coronavirus. Both, by the way, the virus and the alcohol. Don't approach both of those things, okay? So this is the basically the health advice that we are being given. Don't approach, try to avoid the infection, okay, of this coronavirus, right? وَلَا تَقْرَبُوا Corona, okay? That's trademarked, by the way, because I know people are going to try to copy that. But this is official Dr. Syed advice. So how are you going to, how do you prevent yourself? Well, we're talking about social isolation. Everybody knows about hand washing. And I mentioned previously that there was a study done that, you know, washing your hands 5 times a day reduces respiratory infections by 45%. Muslims, we do wudu 5 times a day, and the first step is washing hands. So already inherently, if we're practicing Islam, there's a lot of ways that we're protecting ourselves from this virus. And so what we're trying to do with these viral infections is to even prevent the point where our immune system has to deal with it. So when you're going out, yes, you're washing your hands, you're coming and you're watching the surfaces that you're touching, and you should be careful as well. So remember that virus, even though it can travel within the air, the more readily way that it is distributed or that people can get infected is, you know, through droplets, right? Through saliva, through some type of liquid medium. This is the more likely way that you would be infected by that virus. Now, there are certain surfaces that allow that virus to last longer. Okay, so smoother surfaces like metal and plastic, the virus will can last up to 3 days. Okay, so smoother surfaces, so door handles, you know, plastic, like, you know, the handles of the plastic carts, those surfaces, the virus will last longer. So you have to be especially careful of those surfaces. Things that are more porous, like clothing and cardboard, the virus, about 24 hours. Viruses, generally speaking, 24 hours, okay? So remember, these are general timelines, okay? Inside the house, the viruses, they can last longer. So if it doesn't get exposed to UV light. So outside, the viruses, they will get killed naturally faster due to UV light. So for example, a lot of health facilities, or even spas and so forth that do sterilization, if you have UV sterilization, that also helps to kill bacteria and viruses, okay? So that can also be utilized to help in terms of cleaning the surfaces, besides obviously washing your hands, and when you get home, washing your face. Okay, so washing your hands and washing your face is a very good idea. You know, changing your clothes and putting them in the wash right away, making sure they get washed. So thinking about all the different surfaces that could touch viruses and making sure you're taking the proper steps to wash it. Okay. Now I'm going to give you a very simple and effective way of trying to prevent the viral attachment on your mucosal surfaces, okay? So your upper respiratory tract, because the virus, what it tries to do is through adsorption attach to your mucosa, your lining of your sinuses, your throat, and so forth. So there's a few things that I'm going to give you, and you can look up the studies. There's actually a lot of studies that show the efficacy of what I'm about to tell you. Some of the things that are very, very simple, very easy to do for everyone, it's not very expensive at all. So sodium chloride is essentially salt, okay, or the seawater. If you irrigate your nose, so this is very common to get at the drugstore or the supermarket. So if you irrigate your nose, so sometimes you've seen it like the little pot or the nasal spray. If you regularly do that, that will actually reduce the ability for the viruses to attach to your mucosa. So it's shown to break down bacteria and parts of the virus, and to flush out a lot of buildup of mucus and so forth within your nasal passages. So if you do that on a regular basis, so you say you come home, you irrigate your nose and so forth with that, then it can help prevent that attachment, that viral attachment. That's one of the things that you're trying to prevent, and it's very, very common to get at the drugstores. Actually, there was an article done on CTV News where it showed that they're trying to put like this coating of sodium chloride on masks. So because what it does is it actually breaks down the viruses. It actually breaks down viruses and allows those masks and so forth to be more effective by putting that sodium chloride coating on it. The other very basic thing that you can do is sodium bicarbonate. So sodium bicarbonate is baking soda. Baking soda is another very readily available household item that you can get access to. And by gargling with sodium bicarbonate, baking soda, and actually you can get both. You can get mouth rinses that have both sodium chloride and sodium bicarbonate. So if you rinse with that regularly in your throat, because this is where usually the first symptoms that people will get is throat infection and so forth. And the other one that people are saying is that they get a loss of taste of their taste and sense of smell. So again, these are the two main entry points that you're trying to stop here, right? Is on your nose and the attachment in your throat and mouth area. So if you regularly rinse your mouth out with sodium bicarbonate, and there's studies to show that as well. Another factor and component of it is that a more basic environment that's created by the sodium bicarbonate also helps to counteract the the environment that is more conducive for viral replication. So viral replication, bacterial replication is better in a lower pH environment. So sodium bicarbonate also makes it a more basic environment. Okay. So those are two very simple things. You can just get the ingredients. So all you got to do is you can put literally a tablespoon of baking soda, a tablespoon of sea salt, warm water, mix it up, and you can rinse with that. If you try to flush that in your nose, sometimes it can sting a little bit. So there is formulations that you can get from the drugstore that have sodium chloride in it that it doesn't sting your nose and your nasal passages so much. So it's actually a very good way of protecting yourself from that viral attachment. Also, if you're able, there are mouthwashes that you can get, that, like I said before, that has both of those components in it, and it also has xylitol, which is shown to be antibacterial as well. Okay, so these are all ways to prevent that adsorption. There's also studies that show betadine gargle. So this is with iodine in it, is also has an antiviral effect. So I was given this information by one of my colleagues who's an optometrist, who says that they use these drops for viral infections in the eyes. And there's studies to show that these gargles and rinses are also effective against viruses. They're not as readily available. The studies aren't, I would say, as established as the sodium chloride and the sodium bicarbonate, but it's something that you can look up as well. There's studies that show that there is an efficacy in regards to that. But the whole idea is that you want to prevent the attachment of these viruses onto your mucosa. So again, the surfaces of where it could transmit to, the people that you can get it transmitted through. The name of the game is prevention. The name of the game is do not approach. وَلَا تَقْرَبُوا corona.